Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about triage process policy. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to all ER doctors, all ER nurses, all EMTs, and all ER supervisors. The purposes of this policy are: 1. Rapidly identify patients with urgent life-threatening conditions. 2. Determine the most appropriate treatment area for patients and whether it is available in our hospital or patients have to be referred to other medical center. 3. Decrease cognition in emergency treatment area. 4. Provide ongoing assessment of patients. 5. Provide information to patients and families regarding services, expected care, and waiting times. And 6. Contribute information that helps to define departmental acuity. Definitions. Triage, a process of screening, sorting, or classifying sick, injured, or wounded persons to determine priority of needs, to ensure the efficient use of manpower, equipment, and facilities, and in order to provide best care for each individual patient attending the emergency department of our hospital. The Canadian Triage and Acuity Scale is a tool that enables emergency department to prioritize patient care requirements, to examine patient care processes, workload, and resource requirements relative to case mix and community needs. Priority 1, Level 1, critical condition, life-threatening condition that requires immediate medical attention. Priority 2, emergency condition, potentially life-threatening, requires emergency medical care within 15 minutes. Priority 3, urgent condition, potentially serious, requires treatment within 30 minutes, but not life-threatening. Priority 4, non-acute condition, requires treatment within 1 hour. And priority 5, delayed, can be triaged away to outpatient department or primary health care. Here are some equipments and materials that should be available in the emergency room and help to complete the triage process. Policy. Number one, all patients arriving at the emergency department for care and treatment shall be screened properly by a qualified staff that has the knowledge and training in triaging such patients according to Canadian triage and acuity scale. Number two, here is a brief explanation of the five levels of triage and acuity scale. Level 1, resuscitation. Resuscitative patients will be seen immediately by medical doctor and registered nurse on time. Conditions that are a threat to life or limb or imminent risk of deterioration requiring immediate aggressive interventions. Level 2, emergent. Emergent patients will be seen within 10 minutes by medical doctor and immediately by registered nurse. Conditions that are potential threat to life, limb or function, requiring rapid intervention or delegated acts. Level 3, urgent. Urgent patients will be seen within 30 minutes by medical doctor and within 10 minutes by registered nurse. Conditions that could potentially progress to a serious problem requiring emergency intervention may be associated with significant discomfort or affecting ability to function at work or activities of daily living. Level 4, less urgent. Less urgent patients will be seen within 60 minutes by medical doctor and 30 minutes by registered nurse. Conditions that related to patient's age, distress, or potential for deterioration or complications that would benefit from interventions or reassurance within 1 to 2 hours. Level 5, non-urgent. Non-urgent patients will be seen within 90 minutes by medical doctor and 60 minutes by registered nurse and can be discharged to outpatient department or primary health clinic. Conditions that may be acute but non-urgent, as well as conditions which may be part of a chronic problem with or without evidence of deterioration. The investigation or interventions for some of these illnesses or injuries could be delayed or even referred to other areas of the hospital or healthcare. Number 3, patients with emergent, urgent, or immediate needs are given priority for assessment and treatment. Patients arriving by ambulance with triage level 1 and 2 should be directed immediately to the resuscitation room by the emergency medical service personnel with immediate notification of the emergency department registrar or consultant. Other triage levels can be directed by the EMS to appropriate area inside the emergency department. All patients with triage level 1 and 2 will be accepted whatever the eligibility. Eligible patients with triage level 3 and 4 will be accepted for assessment and treatment. Non-eligible patients with triage level 3A will be accepted to relieve pain, to stop bleeding, or to relieve obstruction in case of urinary obstruction. Patients with triage level 5 can be discharged to outpatient department or primary health clinic. Number 4, in disaster situation, follow the emergency department disaster plan once a disaster code is activated, and triage level shall be done by the disaster triage team. Number 5, all women in imminent labor and or OB/GYN problems with level 1 and 2 should be accepted in OB/GYN section of the emergency department. After arrangement and or urgent consultation can be done for either OB/GYN consultant, specialist, on call or pediatrician as necessary. If delivery proceeds in the emergency department, preparations for both maternal and neonatal resuscitation should be made. Urgent consultation for both obstetrician and pediatrician in complicated delivery in the emergency department. The stage of labor and the severity of the patient should be taken into account when considering transport of a laboring patient to delivery room. Number 6, unless the delivery is imminent, the pregnant patient should be transported to the delivery room of our hospital. Number 7, children should be triaged in the pediatric division of emergency department. Children with triage level 1 and 2 should be accepted. Level 3 and 4 can be referred to children department of our hospital. Number 8, if the patient condition doesn't match the services available in our hospital, we should inform him or his family and help transferring him to the suitable medical center. In this table, we summarized the different levels of triage and the suitable interventions. Policy number 10, ER triage nurse should have the following qualifications: completion of general unit orientation, of emergency room and demonstrated proficiency of assessment and priority setting skills, advanced cardiac life support and basic life support provider certificate, competent in triaging system and other emergency room competencies. Procedures. 1. All patients presenting to the emergency room are assessed by registered nurse in the triage room as quickly as possible after arrival, and assessment is documented in the nursing emergency assessment form, triage level to be tagged. 2. Triage findings include a focused nursing assessment and complete vital signs, and according to the results of the assessment component, the staff nurse will determine the priority level. 3. According to results of assessment by the triage nurse, patients will be classified whether resuscitative, emergent, urgent, less urgent, or non-urgent. 4. The triage nurse will initiate authorized therapeutic measure as indicated, for example, control of fever, airway protection, pressure bandages, elevation of extremity, or cervical cooler. 5. If there is doubt as the proper priority level, the more serious possible category will be assigned and the attending emergency room physician consulted. 6. If the patient condition could be treated in our hospital, we have to inform him or his family and make necessary arrangement to transfer him to the suitable medical center. 7. Post-triage care will be delivered by nurse and doctors in the emergency room according to the adopted triage guidelines. 8. Keep nurse in charge informed of triage status, the say number of patients waiting, any difficult patients, etc. 9. Reassess and document any changes in condition on emergency room department patients in the waiting room as needed. 10. Assist family members with questions and concerns about patients. And 11. Ask for assistance from nurse in charge or security as needed to maintain crowd control. These steps are the responsibility of the triage screen nurse. Number 12, monitor the process of triage on an ongoing basis. 13, provide assistance when indicated or when consulted by triage nurse. 14, notify nursing supervisor as indicated for any problem concerning the patients. And 15, assign and escort patient to treatment area, give patient endorsement to room nurse. These are done by the nurse in charge. 16, be responsible for organizing overall nursing care in emergency room, including triage operation. 17, review triage process as part of the ongoing quality improvement in conjunction with head emergency room department physician. These are done by the nursing supervisor. Number 18, be responsible for organizing medical care in emergency room, including triage operations in process as part of ongoing quality improvement program in conjunction with emergency room department nurse in charge. This is done by the ER head physician and senior physician. Number 19, initiate managing patient-related problems. And number 20, make triage decision on all patients for whom a question exists concerning appropriate triage. This concern may arise from the triage nurse, patient, family, or other personnel. These are done by the emergency room department physician. References: the Canadian Triage and Acuity Scale, and Access to Care and Continuity of Care (GCI) standards for hospitals. Here is the emergency department assessment form in which the triage category should be determined or ticked by the registered nurse and by the doctor. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.